Hello everyone, this is Cristian Spanish Schmidt and this is IMPOCUS or Internal Medicine Focus, point of care ultrasound for all the internal medicine physicians. And today we're gonna talk about ultrasound basics, something very basic, how different probes appear in the screen. So this is just for you to understand what you are seeing in the screen if you are just starting this journey. Again, please subscribe and of course like the video so we can reach a broader audience and especially help those that are starting their point of care ultrasound journey. So first we're going to talk about the phased array probe. So the phased array probe has a very distinctive shape in the screen, and this shape is a triangular shape. We have things like the depth and the grayscale here, and also we have an indicator of where the probe is. In this case, we have a 4-chamber view from a heart. Here we have the typical form or shape of the phased array probe. And the reason that the phased array is phased array in that way is to avoid structures like the ribs you can see in between the ribs. So that's the idea of a phased array probe. Very important that always the structures in these probes that are more towards the borders or the edges of the image are less clear than whatever is in the center. Here again we have a 4-chamber view, and now we're going to see an illustration of how this works. So basically you have your probe. The probe is creating an array that is, or an array of sound that is triangular, and that's because the beams or sound beams are being emitted in a triangular shape, so it can reach between structures that otherwise will make impossible for other types or shapes of probes to be investigated, such as the heart. Phased array probes also may have different settings and different sensibilities to see moving organs, which is something that is important. Then we have the linear probe. The linear probe, you can see that it appears as a square. This is a very important thing. It appears like a square. And again, this is here we have the depth, and here we have the grayscale. This is a grayscale or a 2D image. Also, to the left of the screen, you can see the probe indicator. In this case, we are seeing a joint. This is a wrist that has some fluid and also has fluid around the tendons. And you can see that there is edema around the synovia, and this is because of crystal-induced arthropathy. This patient was diagnosed with that and treated as such. So here we have the probe. As you can see, the probe is flat, and the sound waves have an array that is vertical. You can see that is 90 degrees from the probe. Also, you can change the array in some probes, of most of the probes, to be a little bit more or less vertical. So you can incline this in some angles depending on what you are using or what type of probe you're using. But in general, a linear probe array will appear like you see in the screen. This is very important also because now you do not have the edge decrease of the edge quality, and you have a very good quality at the center. This is ideal, for example, for any type of procedure like placing lines, like doing arthrocentesis, like placing intraarticular injections. That's very important. And lastly, we have the other probe that we use commonly in point of care ultrasound. This is a curvilinear probe. So we have the depth. We have here, that is a grayscale. Very important to notice what type of imaging you are using. And then we have the indicator, or the probe indicator, what side the probe is facing to. And it's very important that here it's an abdomen. We are seeing a kidney, and you can see that this is a curvilinear because you can see the base, or the top in this case, it's a curve, and it appears like a curve with a triangle, or a truncated triangle that goes down. Now that's very important to know that the edges in this probe will have less resolution or will be distorted as compared to things that are in the center. So if you are studying a specific structure, keep it in the center of the probe. And this is how it fares. So this is the probe. You can see that the probe has a curvilinear shape, and this is how the array of the sound beams look like. It's like a curved sound beam. And the idea is to have large organs in large areas to be scanned right away. Of course, there are other probes, such as intracavitary probes, probes that we use in other, like esophageal echocardiograms, even probes that are used intraarterial. Those probes have a different array of the sound waves, and the image that you are going to see is a little bit different. However, we do not use this commonly in the clinic, so we are not going to talk about them. A special thanks to my daughter, Aida Christine, who kindly creates the illustrations in my videos. And again, please subscribe and like the video so we can reach more people. And of course, keep scanning. The only way to get to master point of care ultrasound is scanning, and of course, having a mentor and having opportune or in time and real time feedback. This is very important if you have feedback in real time. And thank you again.